Hey everybody! Today we are going to tackle the transference and the psychotic disorders of teenagers based from the movie The Inside by Tom McLaughlin. Transference neurosis is a phenomenon of the analytic process in certain patients with adequately integrated egos and superegos in which the analysand's perception of the analyst becomes more recognizably entwined with core, organizing unconscious fantasy or memory complexes from childhood. The assumption is that single transference reactions can be fully used to uncover the relevant aspects of the past and can be integrated into consciousness without having to wait for a full-blown transference neurosis to develop. This is in relation to a prominent psychologist who quit after his son's death is drawn into an exceptional case with drastic repercussions in the Inside movie.
Transference neurosis is a term that Sigmund Freud introduced in 1914 to describe a new form of gene, the analyst neurosis and infantile neurosis, that develops during the psychoanalytic process based on Tommy's case history. Freud suggested that during therapy, the creation of J symptoms stops, but new versions of the patient's fantasies and impulses are generated. He called these newer versions transferences and also characterized them as the substitution of G analysts for a person from the patient's past. According to Freud's description, a whole series of G psychological experiences are revived not as belonging to the past, but also applying to the person of G analyst at the present moment. When Tommy was a little boy, her mother abused him. He thought it was just mother's love. Meanwhile, his father was in prison because he killed Tommy's mother for sexually abusing his son. Many years later, Tommy was diagnosed with psychotic disorder, where he hurts all the girls who try to get close to him due to the trauma he received from his mother. One symptom of psychotic disorder, Tommy shows his suspiciousness. He is suspicious of every girl to try to get close to him because he thinks he will be sexually harassed just like what his mother did to him. After the incident, he was brought to a foster home or a center with social workers for treatment because no one will look out for him. Since his father is in prison, Miss Barbara is the one in charge of Tommy's case. He also have a doctor named Dr. Hunter. Dr. Hunter have gradually taken Tommy's heart. Then Tommy began socializing with others. However, not knowing his trauma hasn't needed yet, he attends party and killed a girl who attempted to get clingy to him. Another symptom portrayed by Tommy due to his psychotic disorder is a tendency to hurt oneself or other people. With him killing a girl, it shows he has very strong traumatic experience that has slim tendency to recede. After the incident, a certain girl named Shelley, who happens to be the daughter of Dr. Hunter, Shelley tried to be friends with Tommy. However, Tommy resisted because he does not want to hurt Shelley. However, he unconsciously develops feeling for Shelley. Tommy planned to escape from the center, together with Shelley, who happens to be at their house. He killed Miss Barbara so that he can escape. Dr. Hunter saw the corpse of Miss Barbara. Dr. Hunter chased Tommy and Shelley. When he caught up with the two, he got Shelley and explained to his daughter his condition. And then Tommy flashes back all his experiences. With that, he tries to kill himself by jumping into a train rail. Dr. Hunter successfully saves him. However, he attempted another suicide and successfully succeeded and killed himself. Tommy's symptom is a tendency to harm himself. He is dedicated to kill himself because he can no longer control his anxiety and depression. He feels hopeless and does not want to exist anymore. He belittled his existence, thus killing himself.
Treatment for teens with a psychotic disorder like Tommy varies according to the nature of the disorder as well as the severity. In most cases, antipsychotic medication will be prescribed to help treat the delusional symptoms which the teen, like Tommy, is experiencing. And in all cases, talk therapy will take place in combination with the medication. Talk therapy for the teens in treatment will incorporate a number of different approaches, including group of sessions and family sessions. Some of the most important aspects of this therapy is recognizing and addressing any potentially dangerous hallucinations or delusions in order to protect the teen. Then, therapists work with teens to discuss what the teens are experiencing, provide a safe environment which to evaluate the falsity of these experiences, and then implement behaviors and techniques toward the teen's holistic treatment plan to avoid cases like Tommy and maybe for some teens that are currently having psychotic disorders.